Hello, everyone, and welcome to this edition of Men's Minds Matters. I am your host, Aaron Ryder, and today we're going to be talking about a subject that affects a lot of both men and women, and it is the issue of anxiety. Anxiety affects a lot of people. In fact, I would say that anxiety of some kind impacts all people. We all have anxiety about something, but some people struggle with anxiety a little bit more than others. And often you can get a diagnosis of an anxiety disorder. And then you are given ways of treating that, including therapy and medication and things like that. And we'll get to treatments here in a minute. But I wanted to talk a little bit about what anxiety is and how it impacts you first. So let me bring up the first slide here. So the cycle of anxiety. Anxiety, the cycle of anxiety that we'll be talking about today is a tool that helps people understand how their choices impact their anxiety level. Now, I want to be clear that some people are more disposed to anxiety than others. Just like many other illnesses like diabetes and other mental health diagnoses, there are people that are more likely to develop these conditions than others. So having anxiety or even having more anxiety than other people you know is not a weakness or a flaw. It's just part of being human. That happens to be the what you were dealt in life, and so you have to deal with this a little bit more than others. And so this will help you out with that. The second thing to note on the cycle of anxiety is that it is relevant to everyone because everyone has anxiety, right? But it's particularly helpful for people who have been diagnosed with an anxiety disorder. So while it works for everyone, specifically people who have been diagnosed with anxiety will benefit a little bit more from this than other people. And then being aware, and the whole reason we're doing this is because being aware of your anxiety and its potential impacts in your life can help you make choices that will help you to live a better life. I am a firm believer that sometimes just naming something and recognizing something is a way for us to adjust our behavior. Knowing what bothers us, knowing what impacts us, is usually the first step that we can take to help us live a better and more satisfying life. So that's why I use this tool. It doesn't make up for the fact that maybe you were diagnosed with anxiety or you have a genetic disposition towards anxiety. But nonetheless, we all have to play the cards we're dealt. And if these are the cards you were dealt, this will help you out with that to make better choices and live a better life. And then finally, 1 in 5 people report experiencing anxiety in the last year. And when I first read that, my first thought was, what happened to the other 4? I mean, what's wrong with them, right? Don't we all experience anxiety in one way, shape, or form? And the answer to that is absolutely correct. I think what this is referring to is people who have experienced a level of anxiety that is large enough to interfere with some activity or important aspect of their life. Now, I wanted to pull this up as well. Anxiety versus trauma. So, anxiety and trauma are two very different conditions. However, they look a lot alike, and so they're very easily confused. Also, the fact that one can cause the other in some cases also makes a difference. And the reason it's important to understand it is if you're feeling the symptoms of anxiety, it's important to note that if it is trauma that you're dealing with, your way of handling that will be a little different, and we'll get to that. So, anxiety is defined as a common emotion which is characterized by nervousness, worry, or feelings of unease. Pretty straightforward definition. Most of you know what anxiety is. But it's important because trauma is different. Trauma is a reaction to an adverse or several adverse events in your life. So the reason this is important is because the treatment methods for trauma and anxiety can be a little bit different, and the way that you approach and also the way you obtain trauma or anxiety is a little different. Anxiety is usually a genetic predisposition, and a lot of people face it, whereas trauma is specific things in your life that have happened that have been traumatic events. So the reason these get confused is that a reaction of trauma can be anxiety. Well, that makes sense. If you had a bad experience, you're naturally going to be more worried or fearful about that. And I'm going to go ahead and pull up the next one because it's a good example. An example of being afraid of spiders, that is a form of anxiety known as a phobia. Um, while being afraid of spiders because you were once bitten by a spider and nearly died is a form of trauma. So you can see that there's a difference in how they would play out. Now, when both a person who has a phobia of spiders and a person who nearly died from a spider bite see spiders, you're going to see a very similar reaction. They're going to be very worried and nervous, and they may even have irrational responses to that. The difference is that the person with trauma has the trauma as a result of an event that happened to them. And there are a lot of great examples of this too. I think of someone who has had a severe car accident. I know someone who they were making a left turn and they were blindsided and were in a very severe accident. Obviously, they survived the accident, but the event itself was traumatic. And so they are both afraid of cars, but they don't ever make left-hand turns. Everywhere they go, they will only make a right-hand turn because that is a trauma. It is an event that happened in their life that makes them afraid to make left-hand turns. Whereas most of us, when we're driving a car, we might have some anxiety about driving, especially in difficult conditions and whatnot, but we're not going to not turn left when there's a clear opening because we had an accident. We're going to take that healthy level of fear and respect for a vehicle, and sometimes even a little bit of anxiety can be useful because it protects us. Sources of trauma. There are a whole host of childhood traumas that are out there, childhood abuse, childhood neglect, sexual abuse, exposure to chronic violence in a community. Poverty is even a form of trauma because of the way that it impacts you. And there's a lot of people that have very weird and negative, adverse reactions to things that don't seem normal because of a trauma that they've experienced. Whereas folks with anxiety, they may have similar looking reactions, but it's not a result of something that has occurred. So dealing with trauma is best done under the care of a licensed and qualified therapist. And I want to make that absolutely clear. While there are many great resources about trauma, the best way to handle trauma is to talk to a therapist. And there are excellent ways of dealing with trauma. And there are new ways that people can live a better life, and all kinds of good resources out there. But that you aren't going to solve your trauma by watching a YouTube video. You might not even solve your anxiety by watching a YouTube video, and we'll talk about why in a minute. However, the information on this video is specifically dealing with anxiety. Now, if you have trauma and you are using the cycle of anxiety, you might also find it helpful, but know that it is no substitute for sitting down with a qualified therapist. I also want to point out when we get to the treatments, we'll talk about how therapy and counseling can help someone with anxiety as well. But specifically, if you have trauma, go talk to a licensed and qualified therapist. That is your best way of moving forward with that diagnosis and that event in your life. So let me pull up the cycle of anxiety here. So this is the cycle of anxiety. And I went ahead and got out my big mouse here so that we can see this a little easier. Right up here we have anxiety. So this is that feeling that you have, that worried, nervous, or fearful thing. Let's give an example. Let's just say that you have a fear of public speaking. Lots of people have this fear. Lots of people have this anxiety. Oops. Got to go back. There we go. Lots of people have this going on in their lives. But let's just say your anxiety, let's say you're afraid of public speaking. So now you're working a job and you've been assigned that you have to give a presentation in the next at the next meeting. And so because you have anxiety, you want to avoid that event. So what you do is you feign being sick. You call into work and say, "Hey, sorry boss, I'm not feeling well. Oh, I can't do that presentation." And the thing about doing that is when you do that and when you avoid something, you feel temporary relief. Hey, I avoided that anxiety creating an event, and now I feel better. The problem is, even though you get temporary relief, your anxiety grows and it gets worse. And then in the long run, you have even more anxiety, which means you want to avoid more, which gives you temporary relief, which grows your anxiety, which makes it worse. And so that's why it's called the cycle, because it keeps going back and forth. So, what do you do if you have anxiety and you want to deal with this? How do you deal with this? What are the best ways of that? And that is what the next slide is for. Treatments for anxiety. Now, before I go over all these treatments, and there's 4 basic treatments for anxiety, I want you to know that none of them is a silver bullet. None of them will automatically cure anxiety. What these things do is they help you deal with your anxiety so that it becomes more manageable. Because again, some anxiety is healthy. And so it's important that we have some anxiety in our lives to keep us safe. It's a sign of our evolutionary development. We used to see a saber-toothed tiger and we became anxious, and that caused us to want to run away from that saber-toothed tiger. That is a good anxiety. I've heard a lot of people say, I don't have a fear of heights. I have a fear of hitting the ground on the end of the fall. So, again, same concept there. A little bit of healthy anxiety to make sure that we're on our edge and we're being careful. But how do you deal with it if it's interfering with your life? So, number one is relaxation, meditation, and self care. Um, there is a lot of wisdom that has existed for a very long time regarding the benefits of relaxation and meditation. Simply starting small and doing some meditation will help you to deal with your anxiety, because what it does is it lowers your level of stress and it lowers your level of worriedness and it lowers some of your physiological symptoms and makes it easier to manage. And a great way to do that, of course, is meditation. If you are part of a religious organization, just simply saying some of those prayers that you grew up learning, or engaging in some repetitive behavior can also be a form of meditation. And I wouldn't want to discourage you from doing that. Also, if you've done a sport, like for example, I did martial arts for a while, and we did these. Uh, we did some different things that we would always do them in the same order. They called them forms, and we would call them meditation in motion. That doing a form can help you is a sort of meditation, and I encourage you to look at ways of doing that. There's no wrong way to do meditation if it is causing you and helping you relax. And then, of course, taking care of yourself and doing the things that you need to do to make sure that you're the best that you can be. Number 2 is cognitive behavioral therapy. So, yes, there's a therapy that does work for anxiety. But I want to be clear, and this is where it becomes challenging, because you can go to therapy for trauma, you go to therapy for anxiety, but often they have very different focuses. If you meet with a cognitive behavioral therapist, they will teach you a number of things and help you work through some of your traumas and even challenge you to step outside your comfort zone, which in the long run will help you to face those things and deal with your anxiety. The next one, of course, is medication. There are many people in this world that take medication for anxiety. It can be very helpful at helping to control it. And the good news is there are more and more medications that are extremely effective out there nowadays. There are even some tests that you can take to find out which medication works for you. So, want to make sure that you're talking with your primary care physician about that. And then the last one is exposure. Exposure to your anxiety. And this is one that I find to be very helpful, even in my own personal life. There's a phrase out there that thinking can cause anxiety, but acting can cure it. And if you truly want to work on your anxiety, challenging yourself to face your fears. So, great example is if you have a fear of heights, try bungee jumping or skydiving. I mean, that sounds like an extreme way of doing it, but a lot of people have done that and found that it was helpful to their anxiety level because they faced it. If you have social anxiety, try to force yourself to do social events as hard as it is. You can do that. That is what exposure therapy is. And that's part of the focus of this video, doing things that will help you live a better life. So I want to put them up there again one more time. If you deal with anxiety, doing one of these four things, or especially a combination of these four things, will help you deal with it. Relaxation, meditation, and self care. If it's very severe, go see a cognitive behavioral therapist. You can take medication, and you can just also go out and face that fear and expose yourself to it. And because of that, you can become much, much better at handling it. One last thought on the very last thing of exposure. Just dealing with a child, one of my own children, and we were doing something fun. It was a water park, and they were afraid to go down the slide. And it was kind of cute, but they were afraid. Dad, I don't want to do it. I don't want to do it. And I said, you know what, honey, let me sit next to you or behind you, actually, because it was a two-person water slide. Let me go on this with you. And I will do it with you, and I will give you my strength and help you face this. Because I knew in my head that water parks and water slides are a whole lot of fun. And if this child was not going to go down that water slide that day, it was going to be a long day at the water park. So I did it, okay? So we go all the way down, go all the way down the slide, and they look at me and say, Dad, that was fun. And then they run off and they go back up the stairs. And I'm like, okay, well, maybe I'll go down them again. Maybe one more time will help them. Nope. When I got to the stairs, the last thing I saw was their tiny little head going off the water slide again, this time without me. So that's a great example. They were anxious about this issue, but with a little bit of help and support and willingness to face it, they went down the water slide and they absolutely loved it. Now we can't keep them off of water slides. They're always wanting to go back and try it. So something to focus on. Whatever your anxiety is, try facing it and see if that doesn't help you live a better life. All right. Well, thank you very much for watching. If you like this video, please hit like and share. We appreciate all your support and all the watches and clicks and shares. So thank you very much and have a good rest of your day. Hopefully a less anxious one.